Catheter-associated urinary tract infections. What is a urinary catheter? An indwelling urinary catheter is a drainage tube that is inserted into the urinary bladder through the urethra. It is left in place and is connected to a closed collection system. Alternate methods of urinary drainage may be employed in some patients. Intermittent catheterization involves brief insertion of a catheter into the bladder through the urethra to drain urine at intervals. An external catheter is a urine containment device that fits over or adheres to the genitalia and is attached to the urinary drainage bag. The most commonly used external catheter is the soft, flexible sheath that fits over the penis. A suprapubic catheter is surgically inserted into the bladder through an incision above the pubis. What is catheter-associated urinary tract infection? A catheter-associated urinary tract infection, or CAUTI, occurs when germs, usually bacteria, enter the urinary tract through the urinary catheter and cause infection. CAUTIs have been associated with increased morbidity, mortality, healthcare costs, and length of stay. The risk of CAUTI can be reduced by ensuring that catheters are used only when needed and removed as soon as possible, that catheters are placed using proper aseptic technique, and that closed sterile drainage system is maintained. Can it be treated? Yes, most CAUTIs can be treated with antibiotics and/or removal or change of the catheter. The healthcare provider will determine the best treatment for each patient. Patients with urinary catheter can take the following precautions to prevent CAUTI. Understand why the catheter is needed and ask the healthcare provider frequently if the catheter is still needed. If the patient has a long-term catheter, they must clean their hands before and after touching the catheter. Check the position of the urine bag. It should always be below the level of the bladder. Do not tug or pull on the tubing. Do not twist or kink the catheter tubing.